Good afternoon, Madam President and fellow senators. In opening, Madam, please permit me to extend well wishes to everyone present here today and to the entire island of St. Lucia, as this is my first opportunity to do so in this new year of 2021, in the year 2021, in the name of our Lord. It is with my solemn responsibility to represent the masses of people of our country, having them in mind, that I rise to add my considered thought to the debate in the distinguished upper chamber of this House. Let me take this opportunity also to wish all of our people who have managed to remain safe and spared of any ailment so far, Godspeed, and to extend blessings to continue staying safe and a speedy recovery to those who have not been so fortunate. To the grieving families who have lost loved ones, I render my sincere condolences. And these condolences go out also to Senator Francis, who just stepped out of the chamber, and the other Senator Francis, on the passing of the loved ones. I would also, Madam President, beg to extend some special condolences to a very good friend of mine this morning. Just before I left my house to come to the house, I got a call from his sister, the deceased. And it's a very good friend of mine called Briggy and the boy Matre of Groselet. So with your blessings, I would like to extend special condolences to his family, especially Christine, who reached out and called me. Now to the first item on our order paper here today, Madam President. The COVID-19 pandemic's influence on the 90-day state of emergency, a period of extension being supposedly sought herein for its abatement and eventual eradication from our shores. If you allow me kindly, again, Madam President, I will focus here today not on the medical and scientific aspect of the pandemic, the dreaded virus, which has been cited as the main reason for the extension of the state of emergency. When I speak of these medical and scientific aspects, I speak about non-pharmaceutical interventions, better known as NPIs, the derivative of the R rate, and those of us who do the maths, the delta R, which is the change in the rate of the transmission, the Z or Z factor, or the Z score rather, the measure of effectiveness as determined by various methods of analysis. Instead, Madam President, I will, with your tolerance, discuss a few very relevant and simplified approaches, which, if properly implemented, may very well obviate or reduce the suggested 90-day period, which we speak about presently, of the proposed state of emergency in order to achieve our national objective. So, Madam President, as already articulated by my fellow lead senator and support from Senator Jawai, I would like to reinforce, but also by introduction, I would like to draw to the attention of the Honorable House, 7-point plan yet to be formally adopted, but was advocated by our party's leader, the Honorable Philip J. Pierre. And these are, I will actually point them out, 7-point plan. One, and for those who are taking notes, I will outline all of the plans. One, to expand the testing. And we still get back to the issue of testing, which at pains of being admonished again. Testing, testing, testing. Expand the testing.
Senator, be reminded that this plan was already discussed in this chamber on this bill.
Yes, but I will go on to outline the 7-point plan, which has never been.
So, proceed, but we don't want continuous repetition of the same things already discussed.
I understand that, Madam President, but I want to particularly itemize that 7-point plan because it has never been done before in this honorable chamber. I want to point them out because I think it's a good source.
Leader of government, leader of opposition business did speak to various points in the plan and he itemized them, not the entire plan. That's why I'm saying.
Well, I want to particularly.
That's why I'm saying to proceed. But be mindful that it has already been discussed.
That has already been mentioned, but I want to expand on them in detail, Madam President.
Proceed, you will, Senator, proceed.
Yes. To expand the treatment capacity. But enough of this petty back and forth the last time in the lower house as far as what is in box and what is on standby. When something is on standby, it means that it's ready for use, on standby. As a good Scout's motto said, always be prepared. And when I say standby and ready to go, I mean setting up electricity supply points to a ventilator. I mean the simple attachments such as extension cords. I'm also speaking about the ergonomics in setting up these ventilators. And when I say ergonomics, from a technical standpoint, it's a study of the use of space effectively. You can have a room, Madam President, of 100 square feet. And one room measures 10 by 10, 100 square feet. You have another room that measures 20 by 5, which is the same 100 square feet. But in the first case, you would have perimeter walling of 40 linear feet, whereas in the other, you would have 50. So you'd say it's the same 100 square feet, but one is 10 by 10 and one is 20 by 5. So all of these things have to be taken into consideration when you lay out a room to accommodate sensitive units as a ventilator. The third one, Madam President, is to rethink the travel and tourism related measures. 4, to revise the partial shutdown policy currently in place. Number 5, to protect our education sector and to augment the resources allocated thereto, especially to the little ones. Number 6, to quickly implement the vaccination program. And when I say the vaccination program, not as simplified, we want to go into the procurement of these vaccines. I would like to as well join my fellow senator in personally applauding the Prime Minister of Barbados, and I think correctly it was her benevolence to supply 500 vaccines to St. Lucia in the first instance. And last but not least, to implement a robust economic and social relief program. Now, Madam President, I went over these deliberately and pointedly because I wanted to make reference to an international study. And this is why I wanted to actually juxtapose the political leaders' 7-point plan to what has been derived internationally. So we can appreciate that it's not just peep squeak, so to speak. With your leave, Madam President, I will make reference to a document, a publication by the Nature Human Behavior publication on the November 16th 2020. And if you allow me, Madam President, I will read an excerpt from this publication. It says, and I quote, assessing the effectiveness of non-pharmaceutical, what I just mentioned a while ago, non-pharmaceutical interventions, NPIs, to mitigate the spread of SARS-CoV-2 is critical to inform future preparedness response plans. Here, we quantify the impact of 6,068 hierarchy-coded NPIs implemented in 79 territories.
Senator Francis.
Madam President, I want to stand on a point of order and talk of Section 37(1) and the content.
Senator Sinclair, please take a seat.
Content of speeches. I mean, I'm getting a physiological, whatever word I should use, discussion here. But it is clear what we're discussing this afternoon. We are discussing a motion for the approval of a declaration of state of emergency. So I don't know what about the implementation of ventilators has to do with the state of emergency. So 37(1) is very clear. Subject to the provisions of these standing orders, debate upon any motion, bill or amendment shall be relevant to such motions, bill or amendment, and a senator shall not continue his observations to the subject under discussion. Shall appear. Thank you.
Senator Sinclair.
Madam President, I preface my discussion by drawing the nexus between the main reason why we are going to be implementing this 90-day extension and the COVID pandemic. Yes, Senator? So this, I said, I quoted the effectiveness of non-pharmaceutical interventions. Interventions that could lead to possibly even reducing the same 90-day extension that you are requesting here. So, can I continue, Madam President?
Proceed, Senator.
The said article, Madam President.
Senator, just let me say that you have in fact satisfied me that there is a nexus, but sometimes we have to be a little less convoluted with what we're saying, because we're always not about wasting time in the Senate. Proceed.
Can I proceed along the same course, Madam President?
You can proceed with the same submission, just try to be less convoluted about it.
I will be. It is important for me to just finish the paragraph that I started. Again, it says, and we should listen carefully, in the absence of vaccines and antiviral medication, non-pharmaceutical interventions implemented in response to emerging epidemic respiratory viruses are the only option available to delay and moderate the spread of the virus in a population. That, Madam President, I deem to be very relevant. It's a study that was done in 79 countries, and these were the findings. Government interventions may cause substantial economic and social costs while affecting individuals' behavior, mental health, and social security. Therefore, knowledge of the most effective NPIs would allow stakeholders to judiciously and timely implement a specific sequence of key interventions to combat a resurgence of COVID-19 or any other future respiratory outbreak. Because many countries rolled out several NPIs simultaneously, the challenge arises of disentangling the impact of each individual intervention. To get closer to home and to put it within the local context, Madam President, I'll go on to say One of the issues we can relate to at home is that we would ask and question the fairness and reasonability of the commencement of the 7 p.m. hour, the 7 p.m. to the 5 a.m. We have to consider, Madam President, we live in a country with a very remote transportation system. And case in point is that, assuming that a worker is traveling from Castries to Grace, Vieux-Fort, and the bus driver, the omnibus driver, would have to depart at 6 o'clock to get into the other end for 7. It means that the effective departure time for that person living in Greece would be 6 p.m. And coupled with the limited carrying capacity that we now have of 10 persons on the omnibus, the omnibus driver, the minibus driver, is not likely to come back to Castries. So we can see how this affects the livelihood of workers in remote parts of the island differently if you were to shuttle to Gros-Islet. So we're talking about the difficulty that we would all experience in the implementation of 7 to 5 p.m. There are a number of these non-pharmaceutical interventions that I just referred to. And what I would do is to outline a comprehensive list. And I would like the Honorable House to actually take a note as a checklist, because, Madam Speaker, we are at all times focusing on the pandemic, because the pandemic is the reason why we advocated the extension of the time period for the state of emergency. So if you will allow me, Madam President, I will go through a checklist which I think would be very instructive for future reference. And it takes in more than the 7 points that I outlined earlier. And this is from the internationally generated publication. So we can see and we can compare to see whether the advice that we've been given on this side of the House is in fact substantial.
Please remind me what you're quoting from. This extensive quote that you're going to do now, from
yes,
where?
It's the same that I said. It's from a scientific publication of Nature, Human Behavior, published on the 16th of November 2020.
If it's going to form a substantial part of your debate, it must be laid in the House and the Senate.
I didn't get this, ma'am.
You must make it a document of the
Yes,
House if it's going to
certainly.
be a substantial part of the debate.
Certainly, Madam President.
Is that possible now, or are you going to offer it to
if you
your
have-
colleagues after?
Well, afterward, I could endeavor to make it uncirculated.
Thank you.
A copy of the House. Well, the only thing is that you have my scribble notes on it. Huh? I guess that doesn't matter. Or like Senator Francis said, I could always endeavor to circulate it, the same document, at a later time period.
Correctly, it should be printed downstairs. We have the facility
Yeah, well,
in the
I
office,
just-
and
I
you
just-
give it to the,
Yeah.
you circulate it to the senators at this sitting.
So we continue, Madam President. I was going to give the full list so that we can see whether our locally produced ideas are worth their weight in gold. 1 speaks of the non-pharmaceutical interventions and the considerations to be given. 1, small gathering cancellation. 2, closure of educational institutions. 3, border restriction. 4, increased availability of PPE. We all know what is PPE. 4, individual movement restrictions. 5, national lockdown. 6, educate and actively communicate with the public. 7, and I repeat, 7, the government provides assistance to vulnerable populations. 7, again, if you allow me, Madam President, for emphasis, the government provides assistance to vulnerable populations. 8, actively communicate with managers. We all know the influence of managers over their workers, their peers, and they have reach. 9, measures for special populations. 10, increase in healthcare workforce. 11, quarantine. 12, activate or establish emergency response. 13, enhance detection system. 14, increase in medical supplies and equipment. 15, police and army interventions. 16, travel alert and warnings. 17, public transportation restriction. 18, actively communicate with healthcare professionals. 19, airport restrictions. 20, crisis management plans. 21, increase in patient capacity. 22, special measures for certain establishments. And we could put into these special establishments places like call centers, special production areas. 22, personal protective measures. 23, tracing and tracking. 24, border health check. 25, port and ship restriction. 26, work safety protocols. 27, isolation of cases. 28, repurpose hospitals. 29, environmental cleaning and disinfection. 30, measures to ensure security of supply. 31, active case notification. 32, surveillance. 33, airport health check. 34, measures for public transport. 35, increase in isolation and quarantine facilities. And 36, enhance laboratory testing capacity. So, Madam President, this is, as I can very well see, the members, some of the members on the other side think this is a very exhaustive list. But I went through the pains of actually outlining them to see that this is a scientific approach. This is not just by way of mouth or hit and miss or trying this, and if it doesn't work, trying that. So this is a prescribed, a full checklist of the measures that should be taken in order to eradicate the COVID-19 pandemic. I want to backtrack a little, Madam President, because I want to go back to the issue that we had earlier today, and through you, Madam President, I will address the leader of government business on the other side when she said that there was a deficiency of trust. Now I'm going to explain this deficiency of trust. There's a lack of trust quotient generally in this country, not just on the other side. And I can tell you where it originated from. Because we have a saying that once bitten, twice shy. Yes? So trust, and it's not surprising that there are reasons for the suspicion. We go back, Madam President, to almost the start of the session of the Parliament in which we find ourselves. And a simple matter, Madam President. When it came to the appointment of a Deputy Speaker, I don't have to give you the history on this, Madam President. The Honorable Leader said...
Senator, please take a different line. I cannot see the relevance to the bill at hand.
Yes, the bill at hand, Madam President, is the trust quotient in actually adopting the policies advocated.
Senator, you're going back, as you say, in history. I don't think it's necessary to make your point.
Madam President, I'm not intending to debate with you as such, but trust has history. Trust is historic. Once bitten, twice shy.
Senator, I'm going to exercise a little more, give you a little more leverage.
Yes.
A minute or two, because honestly it's not making any sense.
I understand, Madam President. Madam President, I'll get back on track because I think the point has already been made. So I go on to the same extension, the 90-day extension for the state of the emergency. I want to point out, Madam President, some of the dangers involved. Not that you couldn't take and I understand through you, Madam President, the reluctance by the leader of the government business when she states that she wants to have the facility of a quick intervention in case something comes up. But you have to look at it from a broad perspective. The implementation of a 90-day state of emergency, one of the things that you can very well find, Madam President, is the preemptive or negative business decisions that may be taken by business owners. And by that I mean, if I am a small business owner, Madam President, and I anticipate that I'm going to have a 90-day shutdown because I am a non-essential service, what do I do preemptively? I may start to relinquish my staff because I anticipate that the business is going to get slower. It's not going to get faster. So it's not only one, there's not only one side to it. And by definition, when we say a non-essential service, as outlined in the schedule for essential services establishments and businesses, Madam President, how do you classify a tire repair shop? Is it essential? And we know what obtains within the local context. You have a flat tire and you go to a gas station where obviously they're essential and the pump doesn't work. Where do you get relief? At the tire repair shop. Advocating on behalf of the females, Madam President. Some of them, it's a bit difficult to even change a tire. So they go to a repair shop close by, get it done. So what do we do with the tire man? Do we send him home or does he remain as an essential service? So it is not as simplified, Madam President. So sometimes we have to allow a little bit of flexibility, just as I appreciate you have allowed me here today. So, Madam President, I'm saying all this and I'm going through the pains of outlining all of these to make sure that we convey the notion that it's not only one side that generates all the bright ideas, and it's not all gospel and we have to take it at face value. We will make a valid contribution to the extension of the state of emergency.
You have 15 more minutes, Senator.
Right on time, Madam. I am just wrapping up right now. So I was saying, Madam President, so we will put a point of view across that we hope is appreciated by the other side. And it's not just lip service, okay, it was said, and you have a good point. But when it comes to implementation, nothing is done. So with this, Madam President, I thank you profusely for your indulgence, and I rest.